In terms of some of the internal anatomy of the heart, let's talk about some of the structures and features that we can see here. We've got the interatrial septum. So the interatrial septum is the wall that separates the right and left atria. There's an interesting feature, another fetal remnant that's found in the interatrial septum of the heart. So we've got this structure called the fossa ovalis. And the fossa can be felt as just a slight depression in the wall of the atria. It can be felt on either side, but it's a bit more prominent from the right side. And basically, this is another one of those fetal communications that existed in utero, in fetal life. And this also helped to bypass the lungs. So it helped the fetal circulation to bypass the fetal lungs. Again, because the fetus is not bringing in oxygen, not breathing, there's no need to vascularize the lungs. There's no need for circulation to be going to the lungs. And so in an effort to bypass that, there is a communication from the right atrium right over into the left atrium. So as deoxygenated blood comes back to the right side of the heart, it's gonna just jump from right atrium to left atrium through this communication. While it was open, it's called the foramen ovale. And when it closes after birth, it's called the fossa ovalis. So this is the remnant that is left behind in adult life. There's also the interventricular septum. So this is the wall that separates both ventricles, right ventricle from the left ventricle. Again, we can see that the thickness of this wall tells us that we're in the ventricles, right? The ventricles have a slightly more of a thicker wall and this kind of trabeculated appearance. We'll talk about this on the other slide. Let's look at some of the atrial features. So in the right atria, we can look at the pectinate muscles and the crista terminalis. So the crista terminalis is only found on the right side. The pectinate muscles is found in both atria. And so the crista terminalis is this smooth portion of the right atria. So if we were to look in the atria of the right side of the heart, we would see a smooth part of the wall and then a kind of a ridged part of the wall. And the ridged part is called the pectinate muscle, whereas the smooth part is called the crista terminalis. Down in the ventricles, there are some other unique features here. There's the trabeculae carnae. So the trabeculated or ridged appearance within the ventricle is called the trabeculae carnae. This is basically the ventricular wall. We've got the chorda tendineae, and the chorda tendineae are the cords or strings of connective tissue that are actually attaching to the cusps of the valve. So this is what helps to prevent the valves from prolapsing back into the previous chamber, back into the atria when the ventricle is contracting. So as the ventricle contracts or squeezes, these cords kind of anchor down on the cusp of the valves and prevents the leaflets from kind of flying back up into the atria under the pressure that's being accrued in that ventricle. And then the papillary muscle is the muscular structure that connects the trabeculae carnae to the chorda tendineae. So just to kind of go over the order or the sequence of these structures, again, we've got the trabeculae carnae, which is the actual wall of the ventricle. We've got the papillary muscle, which is the muscular kind of finger-like projection that is reaching up, and it's grabbing onto the chorda tendineae, which are the tendinous cords that are anchoring the valves down into the ventricle and preventing prolapse. And these features are only found in the ventricles, right? Only found in ventricles. Let's look at the coronary circulation of the heart. Now, it's kind of tempting to want to think that because the heart is circulating all of this blood, it's just going to get oxygen from all of the blood that's kind of going through the chambers. Now, that is not the case. The heart gets its oxygen and its nutrients from these very small branches that run on the outer surface of the heart. These are called the coronary vessels. So we've got two main branches of the coronary vessels. There's the right coronary artery, and this is running in the coronary sulcus. We talked about the coronary sulcus, this groove that separates the atria from the ventricle. And then we've got the left main branch, which is called the left coronary artery, and that is going to be on the left side of the heart, and that is going to branch into a few other structures. So the branches of the right coronary artery, the first branch that comes off is called the right marginal artery, and it's going to be running along the right margin of the heart. The left branches, the first branch is going to be the left anterior descending branch, also called the anterior interventricular artery. So both of those terms are interchangeable. LAD, or left anterior descending, is an older term. Anterior interventricular is a newer term. And anterior interventricular is actually indicating the area that this vessel is found. So the anterior interventricular artery is found lying in the anterior interventricular sulcus, if you remember that groove that I talked about earlier on the anterior surface of the heart. The left coronary also branches into the left circumflex artery, which kind of circumnavigates or kind of circumflexes around the left border of the heart. And then finally, it gives off the left marginal artery, which comes running alongside the left margin of the heart. Now, if we look at the posterior surface of the heart, we can see the continuation of these vessels. So the right coronary artery, which gave off the right marginal artery, so this is a posterior view of the heart. So this is going to be the right side, this is going to be the left side. So the right marginal artery, which is a continuation of this vessel, runs along the posterior side of the heart and eventually gives off the posterior interventricular branch, also called the posterior descending branch or the posterior descending artery. Once again, the PDA is an older term, and the posterior interventricular branch is a newer term, which is also indicating to us the sulcus in which this vessel lies, the posterior interventricular sulcus. Let's talk about the veins of the heart. Now, it's nice to associate the veins with the arteries with which they are corresponding, or the arteries with which that they're running with. So we've got the great cardiac vein. It's running in the anterior interventricular sulcus alongside the anterior interventricular artery. We've got the middle cardiac vein found in the posterior surface of the heart. This is running in the posterior interventricular sulcus alongside the posterior interventricular artery. And then along the right margin of the heart, we've got the small cardiac vein, which is running alongside the right marginal artery, okay, on the right side of the heart. We also have the coronary sinus. So this is one of the bigger veins that is found alongside the heart, along the surface of the heart. It's running in the coronary sulcus. It's found in the posterior aspect. And this is kind of the confluence where all of these veins drain. So all of the veins, great, middle, and small cardiac, drain into the coronary sinus. And the coronary sinus is going to wrap around the heart and dump immediately into the right atrium. So this is how the heart kind of collects the deoxygenated blood that is coming back from the coronary circulation.